Hello.
Yeah.
Welcome, ladies and gentlemen, to our online conference. My name is Sergio Seebohm. I will be the moderator. Most of you expected Jakob Simmank here in my place. Unfortunately, he fell ill, and we wish him all the best for his health, specifically in these strange times that we're all in. We have an important discussion nevertheless. The Global Fund has been supporting more than 100 countries over the past 18 years in their fights against AIDS, TB, and malaria. And over 38 million lives have been saved. And this is amazing news. It shows that the political and scientifically led interventions that we as an international community come up with are working. And there's more good news. Many countries that are receiving external support are coming to a point that their disease burden is being brought down considerably, or their economies grew to be much stronger, or even both. But as often in politics, in the fair way of good news, there are sometimes new issues to be found and discussed. And what do these successes mean for external support is one of the questions that we want to discuss. That's what we want, why we are here. And I would like now to give the floor to our host and the initiator of this conference, the Vice President of the Friends of the Global Fund Europe, former Minister, Ms. Wieczorek-Zoll.
Thank you very much. I think we all can hear each other. Thank you. And thank you, Sergius, also for, standing in because Jakob fell ill. And thank you for being here, Katharina. Thank you, Kara, Andres, Raminta, Dr. Kusin, Ms. Pickle, Matt, Dr. Sukat, and Manoj. I hope I pronounced the name all right. And it is
correct. Thank you.
It is wonderful that so many impressive experts decided to join us in this meeting. And I'm very excited to listen to your contributions and to learn from your perspectives. And when we planned this conference at the beginning of this year, of course, we would have thought that we could meet together face to face, that we could shake hands, that we could chat after the conference. But the pandemic has changed this idea, and of course, it has changed many more points that we all know. Our question when we discussed to prepare such a conference was, as Sergio said, when countries transition to a higher income status, there are new challenges for these countries. And we would like, of course, to discuss those specific challenges and how to deal with them. And so many years, you, I, the global health community, you all, we had were hoping for recognition and also for reception and relevance for health systems questions and for global health topics. Now global health has a lot of attention, but not for the reasons that we would have given. And now COVID is also threatening the successes that so many of you, so many of our viewers helped to achieve. And Sergius mentioned them at the beginning. The Global Fund just wrote this down for us a few weeks ago. 38 million lives saved, 20.1 million people on ARVs, an increase in coverage from 48% in 2015 to 67% in 2019. And 5.7 million people being treated for TB, an increase in coverage from 48% in 2010 to 65% in 2015. Those are our achievements, the achievements of the people that worked for the fight against HIV, AIDS, malaria, and tuberculosis, and after years of struggle. And we must not give up these achievements. But it is also true, and we'll discuss that today, COVID is threatening the successes we had achieved. Poverty is growing instead of receding. The supply chains for treatment have been interrupted in many cases, and also quite a lot of programs of the Global Fund were impacted by the situation. Now, transition processes, when you read or listened to this point, what a title. Here's the question: how many of you thought this is a terrible technical idea? Well, please be honest. If you said yes, great that you're still here. Here is what I think. Health is a human right. This is about brothers, about sisters, about moms, about grandfathers, about daughters. We need to get those transition processes right. We need to get them right, because if we don't, we lose the achievements that we have fought for so hard, and it will come after us. It will come after our brothers, moms, sisters, grandfathers, and daughters. And it is not at all technical. It is a question of life and death. I'm grateful that today we will learn so much about how we can make transition processes work even under the present conditions we are in. And thank you for joining us, and thank you for bearing with us in this conference.
Thank you very much, Heidemarie. And unfortunately, in this digital surrounding, we cannot hear the applause of that usually the audience, I'm sure, would be giving. The next speaker definitely deserves a great round of applause as well. And I want to introduce her really quickly with a quote. We reaffirm that the SDGs set a broad and ambitious agenda for a safer, fairer, and healthier world by 2030 to ensure healthy lives and promote well-being for all at all ages. We must achieve universal health coverage by working together effectively to strengthen health systems and improve health outcomes in all countries. That is a quote from the signatories of the Global Compact of the UHC 2030 partnership, which, among others, of course, Germany signed. UHC 2030 is the platform that vows how to achieve universal health coverage by 2030, and they have a brilliant working group that specifically focused on transition. And I'm very proud and grateful that we have the co-chair of this working group with us here today to tell us just a little bit about the work and findings that they gathered. I welcome very warmly from the London School of Hygiene and Tropical Medicine, Professor Kara Hansen.
Thank you very much. Thank you very much. It's a real pleasure to be here today. So I, as Samuel said, I am the co-chair of the UHC 2030 Working Group on Sustainability and Transition. So this working group was established in 2017 in order to create collaboration and consensus amongst key actors on transition work that aims at sustaining effective coverage of quality interventions and outcomes towards UHC. That's really important because it focuses not on sustainability as a narrow financial notion, but on the ability of programs to sustain health outcomes. And that's been very much the working mantra of the working group. And transition, and by transition we do mean transition from external funding, is a really powerful lever and an entry point to support the alignment of work for universal health coverage. The members of the working group are drawn from country representatives, importantly including officials from both ministries of health and ministries of finance, a range of health system and disease experts from the World Bank and WHO, bilateral partners, global health initiatives, other organizations, academics such as myself, and think tanks and civil service organizations. And I guess, kind of rethinking where we are now, of course, one of the most important changes that we need to take up in our next phases of work are how COVID-19 has really redefined the context of health, and to ask, what does this mean for external financing? So I will come back to this towards the end of my talk. In its 3 years of existence, the working group has been active. We started by doing a mapping of policies and definitions and ongoing work by members of the working group that are related to issues of transition. It was also very important to us that country voices were the loudest voices in the room. So we had a country consultation on country perspectives on both sustainability and transition. We were also interested in understanding the patterns of transitions. We looked by country at the donor transition timelines for all low and middle income countries, thinking by country and by funder, and also set that against a background of indicators of fiscal space to think about fiscal capacity to manage transitions. We had a very interesting day of consultations with some of the key, the health programs. I call these vertical programs. They're not always vertical programs, nor are they always disease programs, but those programs that tend to be the subject of transitions, and in order to understand from them their challenges in terms of sustainability transition, but also importantly, the commonalities. I'll come back to that commonalities issue in a moment as well. And we've had 4 face-to-face meetings across our set of actors, and the reports from those meetings are available on our website. We produced 2 years ago and actually launched at the Health Systems Research Conference in Liverpool in 2018 our statement on sustainability and transition from external funding. And that identifies a number of the key concepts related to transition, includes recommendations and principles. Very excitingly, we're just about to launch, in partnership with the Alliance for Health Policy and Systems Research, based at WHO, a research program that's going to enable national research institutions to inform practice on transitions, again, through a country lens. So this will include 6 country case studies, the development of an overarching framework and some cross-cutting analysis. And the principles have also been taken up in some very specific countries. So in Kyrgyzstan, for example, the transition principles were integrated into the new sector coordination agreements. And they've also been reflected in some of the transition planning for HIV in countries such as Morocco and Cote d'Ivoire. The principles have also been referenced in joint donor statements by the Global Fund, Gavi, and GFF as part of the GAP Health Financing Accelerator documents. The principles are made up of a number of blocks. So one of them is the ultimate outcome, which is universal health coverage and the sustained and increased coverage of health programs and priority interventions. And that's really underpinned by 3 ways of working. So one is country ownership and good governance that works to strengthen national institutions. A second principle is to work together. So that means looking at both those who take health system perspectives and those who take disease program perspectives, coordinated transition plans, and looking for consistency and synergies. But also the whole sustainability notion is grounded in the efficient use of resources. So that means not taking a disease perspective or a program perspective, but taking a health system perspective. It means mobilizing adequate domestic resources and through progressive means. And it means really improving the ways that resources are used, looking for synergies and efficiencies in order to generate resources to sustain these programs. And these then 3 blocks of principles are underpinned by notions of political commitment and accountability. So the last couple of things I want to say are really about how COVID-19 is going to affect the transition from external funds towards universal health coverage. And I think there are 3 main issues that we need to be concerned with. The first is the impact of COVID-19 on domestic resources. So we are seeing reductions in GDP that are more severe in high-income countries, but middle and low-income countries will be affected by the global economic slowdown that is the consequences of those reductions in growth in high-income countries. And those reductions in growth could persist for some time. There's certainly some modeling work that suggests that without a coordinated international response, that shortfall off the trajectory of growth could persist for between 2 and 4 years. That means that countries are taking up loans and they are running fiscal deficits. It means that the outcome of all this will be reduced public finance for health, whether in the medium or the long term. And also for countries that have limited fiscal space, there may also be a need to restructure debt. The second main impact is through the effects on development assistance for health. So that trajectory is unclear, but given the fiscal contraction in high-income countries, it could mean stagnant or reduced availability of development assistance. It was reported on the news here in the UK last night that the government are looking at whether it's possible in the current public expenditure review to reduce the commitments to development assistance, and that will have consequences. And I can't imagine that the UK is alone in questioning its abilities to sustain development assistance. And so what then is the net effect going to be on transition? Well, the first is that there's just going to be less public money available for health, which means less funds available to compensate the withdrawal and reductions of external funds. What this means is that how resources are used becomes even more important. That reinforces the importance of sustainable transitions, of transitions that are rooted in finding new ways to do things that look for efficiency improvements across the board. And so just a final couple of thoughts about what this means in practice. So COVID actually provides an opportunity to better manage these transitions and the relationship between domestic and external financing. What it means is that actors are able to come together to support more efficient and more coherent systems that are oriented towards this. Now it becomes a magical mix of solidarity and health security. I think we understand now more than ever that those things cannot be separated, that without solidarity, we cannot ensure health security for us all. So the political moment from that I'll come back to at the end of my remarks. Past approaches have tended to be focused on specific health outcomes, but also to some of the cross-program inefficiency, or the cross-program workings that with better coordination can enable efficiencies. And here we're talking about things that are on the agenda for today, things like shared data platforms, like shared procurement systems that will enable transitions to lead to greater efficiency. The current responses to COVID have some risks. There's a risk of fragmentation. There's risks of inefficiencies in procurement. Again, I can look at my own country for the papers being full of those today. And also, I think a risk that the additional resources refocus attention on hospitals and clinical care. But there's also opportunities. We have seen countries respond rapidly and very flexibly their financing arrangements to be able to integrate better the private sector as providers of services, and also to find opportunities for greater intersectoral collaboration. In the future, we're going to have to really come to terms with and address the failures of the past in terms of understanding and investing in common goods for health. And that includes particularly public health services, that include emergency preparedness and the importance of solidarity. But I think the real opportunity here is for us to see this, the political moment. People are focusing on health. Health is if health affects the economy, who could possibly argue with that now? It's so clear. But also that we do have this opportunity to align the priorities for solidarity and for risk sharing across the whole population and see that as a prerequisite, in fact, for health security. So there are risks, but I think there are fantastic opportunities. And I really look forward to hearing the discussions of this group about these issues this afternoon. Thank you very much.
Thank you.
Thank you very much, Professor Hansen, and a virtual applause for you just as well. Thank you very much for giving us this really concise and tremendously helpful insights into what has been already achieved by your group in identifying the challenges, but also the opportunities. I put the magic mix of solidarity and health security definitely on my list of talking points for the further future. We want to discuss now some of these challenges and also opportunities, particularly in the context of the European Union. The European Council, as we all know, is currently led by Germany, which announced as a council president to focus on health issues. That was even before COVID arose. But the European Union has also many partners on its borders, such as Armenia and Kosovo, that were successful in getting down their disease burdens. So there might be candidates for future transitions. And there are also partner countries that are still struggling with considerable challenges. Fight against tuberculosis, HIV/AIDS, in some parts of Central Asia on the rise again. I want to discuss this with two ardent Europeans who have both achieved most distinguished roles as a result of their political engagement. So I welcome very much the Vice President of the European Parliament, Dr. Katharina Barley. Welcome.
Thank you. Good to see you.
And I also welcome the Professor at the European University Institute and former EU Commissioner, Mr. Andris Piebalgs.
Hello, good evening. Well, good afternoon. It's dark in Vegas, so sorry for mixing it up.
It's different time zones for all of us. For Manoj, it's even a bit late in the day. Ms. Barley, Heidemarie reminded us health is a human right, but health and health systems are being put under an immense test currently in Germany, in Europe, around the world. And the COVID-19 pandemic has reminded the world of how serious these threats of emerging infectious diseases are for human health and for our economies. And Kara reminded us just as well just a few moments ago. What are your thoughts?
Well, I would like to relate to what Kara just said, because this is exactly the situation. The COVID-19 crisis is a risk and an opportunity at the same time, because we have seen in the very first place member states of the European Union, but also other countries around the world acting egoistically in the very first place and thinking about themselves. And even the most logical approach is to contact the neighbor state. For example, when it came down to closing borders, weren't taken. I mean, measures like this one were taken unilaterally. Nobody would have considered that possible, I think, a year in Germany or the European Union. So this was what we actually saw in the first place. But then, of course, it is so evident, as Kara pointed out, that viruses is viruses the plural to virus? I'm not really sure of that.
I think it is.
That a virus doesn't respect the border. I mean, they don't care. So the second part, of course, was that everyone became aware of the transnational nature of pandemics, or let's enlarge it a bit, of contagious diseases. So this awareness is something that we can really make more of in the European Union and globally, because this sense that how health systems work in other countries, how diseases and pandemics are being fought in other countries might have is not only interesting for us because of our humanitarian approach to politics, but also because it might affect our own health system, our own population sooner or later. So this is one aspect, and maybe just to touch briefly upon another one, it has also made clear how things are linked. That's those who are more vulnerable anyway, those who are in need anyway, those who have less resources are, of course, the most affected. That now we can not only see in developing countries, but also in our backyard, with our friends and neighborhood. So I completely agree with Kara that this is also an opportunity for the Global Fund and for our purpose.
So let's take a look at the neighborhood. Let's take a closer look at Eastern Europe. Andres, 5 years ago, there was the Latvian EU presidency, and you helped a lot to bring about the Riga Declaration, which took a specific look at TB, which is a challenge in some parts of Eastern Europe and Central Asia, also with drug-resistant TB on the rise. The declaration includes 10 concrete recommendations to improve TB care and control. Do you think 5 years later on, that was a success? Are we where we hoped to be 5 years ago?
Well, we definitely want it to be better, but it is success because European region has a reduction of 19% in the TB incidence rate between 2015 and 2019, a 31% reduction in TB deaths, and also there have been some improvements in MDR TB, multi-drug resistance. So they have been. But saying said this, I think Hademari started very important point about where departure should be, because COVID brings a couple of considerations also relevant to transition, but general approach we had. First of all, you can't work without having result in mind. So in our case, it is SDG 3 and its target 3.3 by 2030, and the epidemics of AIDS, tuberculosis, malaria. It's not about reshuffling funds here and there, but strategically thinking how you deal with this, how you achieve this goal. The same is COVID. If we would not have vaccine, anyhow, governments would need to say what is the strategy, because no one would stay in confinement for 25 years or 30 years. Yeah. So that could be a strategy, but nobody would accept it. The second is coverage, because, we know the cases that we discover. And in a multi-drug resistant tuberculosis, we have higher number, but we don't know it is because of better testing or it is because of new cases. So we assume that we have more new cases, but we need good testing. And that was what was done for COVID was a good example. Do testing, because only then you could really sort the issue. And third, about the health systems. Well, my wife is in frontline with COVID. She works in intensive care unit. But they have only as much beds as they have. They have as much, personnel that is, especially the lower medical personnel, that is very limited with knowledge to do. And you can't expand it immensely when the crisis comes. So better do that you don't come to the crisis. And I think this philosophy should be also now need to be applied to three diseases. It's not mass how to reshuffle, but how to achieve the goal. If it's not 2030, 2035 perhaps also will do, but you need to have a strategy towards it. And I think this something is missing also in recent European institutions. I read the joint statement of the European Commission and the WHO Regional Office for Europe. It's good statement, but if you would look for TB or Riga Declaration, it's not mentioned. And I would say, is it a big problem? Yes, it is, because that is our commitment in this region to put it away, not to take some countries off the list. So I think the philosophy should be different.
Well, then let's talk to the European institutions. We have the Parliament sitting here. Katharina Barley, so COVID-19, without any question, is putting health systems under pressure. And how far would you think did this change the debates in the European Parliament? And maybe to slightly to a wider point, the EU has been criticized throughout the pandemic for not doing enough in terms of health response. Is that fair criticism?
Well, no, it is not a fair criticism, because it's not on my behalf now. I'm defending the Commission too. It is because the European Union does not have a lot of competences in the field of health. And this is one of the problems. And I like to say that the European Union grows or develops in times of crisis, like many organizations do. I mean, we saw the financial crisis in the last decade, and we saw what happened then. The European Union stepped up and created rules for the banking sector, etc., and built safeguards, etc. And now we're in the middle of a pandemic, and now, of course, people are asking, what is the EU doing? We're not doing enough because we can't do enough. So maybe we should think of not giving the complete health sector to the European level, not at all, but to have a look at where it makes sense to widen the competences of the European Union. And I just mentioned the financial crisis. What has become absolutely clear is the connection there. I mean, we have seen, especially Italy and Spain, being very much affected, and with their health systems not being able to cope. Why not? Because during the financial crisis and following the financial crisis, they have been forced, especially these countries, have been forced to cut down their expenses also in the health system. So we see the consequences of this policy now. So that and one might not think, but that happens. But I think this has really created a learning process within the policymakers, especially the Council, because this policy of cutting down, the southern countries were very much afraid that this would happen again.
Yeah.
That countries like Germany would say, yes, we will help you economically, but only if you do this and that and that, if you cut down pensions, etc. And they did not this time. And I'm very proud of that, because it means that they have learned lessons. We need a stable social system. We need a stable health system. It's the basis for everything. It's also a basis for the healthy economy, as Heidemarie and Kara pointed out already, of course.
Could I ask you a question in between, Katharina?
Sure.
Sorry, because I mean, what happens? Of course, we have now the agreement between European Union and Council on the budget, but what's the assessment of those countries that, in a way, used the recovery fund and their consent to the recovery fund in order to reduce the budget of the European Union over the years? I think that's a disgrace.
It is, absolutely. And we are, when it comes to funding at the moment, of course, we are in a very difficult situation altogether. It's a very new situation. We have the Brexit. So we have the British contribution that is missing. We have the economy being weakened in all the member states. And we have the additional costs of the recovery within and after the COVID crisis. So we are at the moment, when it comes to funding, in an extremely delicate situation. And I'm quite proud of the reaction that the European Union has shown up to now. But of course, it's all being endangered by the reaction of 2 member states. As you know, I don't want to elaborate too much on that because it's not the topic of this session.
No, of course not.
We're not through. It means we're not through yet. And maybe we'll come to that later. But also when it comes to funding on health, the propositions by the Council were a shame, I have to say.
That's true.
Andres, I'd like to get you back in here because Katharina Barley just pointed out there was a strong activity of solidarity within the Union, within member states. There is support and even strong support. Now we have, with regard to the 3 diseases, we do have strong challenges and pockets within countries of the European Union as well, but also a lot of among the countries of the Eastern Partnership. In how far can activities of the European Union bridge into those partnering countries? How can they be part of a joint endeavor to overcome the challenges that we have with the 3 epidemics anyway, and with the additional burden by COVID-19?
Well, I think it's quite challenging because it's basically there are 2 or 3 issues that are coming together. One, these countries need good governance. Good governance, you can't get it one day, but you need a very strong commitment, because without good governance, there is always risk of backsliding. The second issue is very much related with the funds that countries have. Let's take Armenia now. So it's what do we expect from health systems there? So it's really overburdened to impossibility. So health system fragile. And then last is people who are affected by TB or HIV. In this case, they are completely marginalized, but they are humans. So they are human rights issues. Somebody needs to take care. And in these situations, I believe that at least with neighborhood, we should prioritize that we are addressing the people that will get no support. And then there is an NGO. There is also a lot of people in these ministries of health and also in some specialized institutions that are passionate about doing the job. We need to support them. And then this GNI per capita criteria is irrelevant, in my opinion, because it does not reflect support to the marginalized groups and to the people that actually make the backbone of the health system, because it does not consist only of money. It consists also of skilled people that are there and dedicated people in it, and a lot of them work not only for money. So I think always this, we sometimes forget that there is financial aspect, it's important, but it is also human aspect is important, because the people that are going in health system, most of them goes because they like the job, that they love the job, not about the money on it. And saying said this, I think what coming back to the EU in general, I definitely would like more consistency in the EU, because what does it help if country X puts a lot of money in health system and country B in the EU does not do? So that means that skilled health professionals move from country B to country A. That is the goal of it? No, it should not be. I believe the first step was very important for the EU, this common buying of vaccines. Well, perhaps it's not the first step, but the most visible step, because that's at last makes sense. I would love that Commission comes as soon as possible how to distribute them to the people with the scheme, because that could be also misused. I have full trust that it will be done in a good way, but it's also important to understand how the vaccine comes to particular country or group. So far, nobody has asked, but I think this looking forward is so important in today's world, because that recovers the trust of the people, and people ask simple questions that need to be answered.
Thanks, and I think one of the issues, of course, procurement. That's definitely an area that we still want to touch today. But I really want to underscore the point that you made about the people involved. And let's talk very practically, Andres. Let's please give us a very brief description or insight. A prisoner in Armenia or Russia today. What's that person's kind of life? What's that person's chance to be protected from HIV and TB?
Well, you need also to see it as a particular area, but it's definitely lower chance, because hospitals are overburdened with COVID. Then there is also financial systems are not in perfect order, so there is less money, and so they try to achieve the politically easier targets. So you are going where the mainstream, because that's where votes are, not to the people that perhaps never will vote. So that, I think, is the logic, and it's difficult really to blame the authorities for it. It is true that somebody needs to pick up that each and every person have a chance and involve authorities in this work. So it's not just pointing on them, you are not doing your job. No, also trying to support this job and to give this. And I think these philosophies clash quite a lot. Let's take polio as an example. Why polio was a good case? Because very few people are affected. But it's better to eradicate it, the polio, than to keep it being out. But politically, Well, how many people are affected? How many lives I'm saving? Well, not so many, but you need to look in perspective. And that's exactly with TB in European region. You need to see what you are actually trying to achieve. You try to eradicate this. And if you manage with one region, you can do in other regions as well. So I think that is a philosophy that COVID is bringing. You can't stop somewhere in between expecting that things will improve. And European region is also important with this multi-drug resistance. 50% of multi-drug resistance comes actually from the people that have been treated well. So it was a mistake, some things in the system. We spend money and now we pay by far more. So we need to eradicate.
Katharina Barley, Andres keeps admonishing us. We need to look forward. We need to plan. We need to act strategically. So that's leadership. Basically, that's what we're talking about. And the German presidency of the council said they would want to focus on global health. So did they?
Well, of course, everything turned out to be a little different than things had been planned in advance. I mean, and the German presidency had taken over already before COVID was not a small one. I mean, as I mentioned, Brexit and the financial problems already. But yes, they did take it on. I mean, already the Finnish presidency had started a multi-annual program on ensuring global health, and in November, if I'm not mistaken, the council launched a declaration on global health, which especially is entitled to strengthen the World Health Organization. I think there would have been a bigger outcome, I must admit, if COVID hadn't occurred. I'm being very honest here, because I mean, I'm not speaking for the council or the presidency, but of course a lot of forces have been concentrated on the fight against COVID. And there also, it is not only on fighting it domestically or within the European Union, it's also on fighting it globally. I think the efforts that the European Union is making to make vaccinations accessible all over the world, not only in the wealthy countries, I think this is one of the points that one can line out. But as this is a multi-annual initiative, I hope that the coming presidencies, Portugal and Slovenia, are going to push this further. I hope that we will have a vaccination for COVID soon, and then that the attention will be broader again.
Thank you very much. Thanks to both of you for this really inspiring conversation about the European perspective. We will stay in Europe with this discussion because we want to take a look at a case example. How does a country actually prepare for a transition process? And we are very fortunate to have a representative of Ukraine here with us. But before we go there, we want to be conscious of the fact that we are having way too many video calls, all of us at the moment. And this is why we built in a little small break for each of you to, take a look at really urgent matters, take a deep breath, and we will hear back with the case example of Ukraine at 4:30 Central European time, so in 10 minutes from now.
Don't leave.
Don't leave, stay with us. There's
leave.
No commercial break. We will just be back. Thanks.
Thank you.
Thank you, Jagis.
that are working towards universal health coverage to gradually transition from external support. And I'm very excited that we will now learn about a very concrete example, the example of Ukraine. Ukraine, a large country with tremendous potential, but also some challenges, notably armed conflict. However, this country is displaying remarkable leadership in already making efforts to prepare for transition. And I'm very, very grateful that these considerations will now be presented to us by the acting Director General for the Public Health Center of the Ministry of Health of Ukraine. Welcome here with us, Dr. Ihor Kuzin.
Да, уважаемые коллеги, добрый день. Я буду говорить на русском с переводом.
Greetings, dear colleagues. Could you hear us fine? Ihor will continue in Russian, and I will provide interpretation to English. Could you hear us okay? Could you hear us?
We can. Yes, we can. Wonderful.
Wonderful. Thank you.
Отлично. Прежде всего, хотел бы поблагодарить за возможность презентовать опыт Украины и в том числе представить, наверное, одну из лучших практик, которая сейчас у нас есть.
First and foremost, I would really like to present the experience of Ukraine and to present one of the best practices that we have currently in our country.
И действительно, вопросы перехода от донорского к бюджетному финансированию для очень многих стран является ключевым вопросом, и действительно рано или поздно его приходится начинать решать.
And really, the transition period from the donor funding to state funding is one of the key issues that, when the time comes, you really have to solve this.
И решение этого вопроса в Украине началось в 2018 году, когда в сотрудничестве с благотворительной организацией «100% жизни» была создана рабочая группа по целям расширения и по общепрограммным вопросам лечения антиретровирусной терапии.
And this whole process started in 2018 with the NGO 100% Live. We've started to implement this process by creating a working group.
И основные достижения этой рабочей группы – это разработанная стратегия оптимизации лечения, то есть внедрение новых препаратов на более дешевых схемах и более современных.
And the main achievement of this working group is actually the optimization or the advantages in the treatment approaches and treatment regimes by optimizing to more cheaper versions and to more of a newer or advanced versions of the medicines.
В рамках этой рабочей группы было адаптированы национальные клинические определенные документы, и в том числе все национальные протоколы были адаптированы к рекомендациям Всемирной организации здравоохранения.
And the framework of this working group, we have adapted to the requirements of the national clinical guidelines and protocols in accordance with the WHO's recommendations.
И на самом деле сообщество пациентов с момента вхождения или с момента создания этой рабочей группы, оно начало иметь влияние на формирование номенклатуры и самим процессом проведения закупок.
And what was wonderful is that the patient community was able to be an active participant of this working group and actually influence on the nomenclature and actually influence on the types of medicine that they were going to receive.
И огромным достижением, которое есть, это то, что пациентские организации начали проводить прямые переговоры с фармацевтическими производителями для того, чтобы снижать цену на препараты.
And what was also a wonderful and great achievement is that during this working group, patient organization has actually started to have their own discussion with Big Pharma for them to lower the prices and actually introduce medicines on the Ukrainian market.
Проводить переговоры про выдачу добровольных лицензий и в том числе опротестовывать вторичные патенты в судебных органах.
To give voluntary licensing, to pass the voluntary licensing process for the medication, and to actually go in court for the patent evergreening process not to happen for medicines in Ukraine.
И все эти переговорные процедуры, они привели к тому, что в 2019 году у нас успешно снизилась стоимость схем антиретровирусной терапии.
What has it all together led to is that in 2019, we managed to successfully reduce the cost of ART schemes.
Только для первой линии лечения общая экономия составила практически 359 миллионов гривен.
Just for the first line treatment, the overall savings that we have because of that was 359 million hryvnias of the local currency of Ukraine.
И именно это обусловило то, что в стране появились свободные деньги, которые для Министерства финансов не нужно было искать или забирать у каких-либо других программ.
Which was wonderful because the Ministry of Finances finally saw that they have available funds that they wouldn't have to take from somewhere else or to repurpose from something else.
Поэтому большая часть этой экономии была распределена именно на финансирование услуг по профилактике и уходу и поддержке.
This is why the biggest portion of the savings was reprofiled for the prevention and support services for HIV.
Совместно национальными группами была проанализирована нормативная база и разработаны варианты включения услуг по профилактике и по уходу и поддержке в государственную бюджетную программу.
And so by this national group of experts, they actually worked on the legislation and on the way how to include those preventative or supportive services into the state regulation for them to be covered by the state budgets on forward.
И в 2019 году появилось постановление Кабинета министров Украины, которое фиксировало порядок использования бюджетных денег на предоставление услуг группам высокого риска в отношении инфицирования ВИЧ.
And so in 2019, a cabinet of ministers of Ukraine, they actually announced a decree that actually states a procedure on how budget funds to be used for these services and for the preventive services for high-risk population that can be infected with HIV.
И действительно, в дальнейшем этот процесс уже начали поддерживать абсолютно все партнеры. Глобальный фонд, CDC, USAID, UNAIDS, Всемирная организация здравоохранения.
And later on, this process was actually supported by every international partner that we had, including Global Fund, CDC, UNAIDS, and WHO's office in Ukraine.
И два основных приказа или два основных порядка были утверждены Министерством здравоохранения. Порядок предоставления услуг по профилактике и порядок предоставления услуг по уходу и поддержке людям с ВИЧ-инфекцией.
And so based on all of that happened, there's two key aspects that was made. 2 orders of Ministry of Health was approved. One order was specifically targeted for the preventive services for HIV, and another is the support services for HIV population.
И также, поскольку это уже было бюджетные определенные расчеты, это бюджетные финансы, была утверждена методология расчета тарифов и были утверждены граничные тарифы, выше которых государство не имеет права закупать эти сервисы.
So because it's budget funding, there have been budget calculations conducted, and they also has matched thresholds. The threshold in this case is the level of the fee for service after which or higher than which the government cannot really pay.
И что еще является довольно важным, что для обоих направлений, как для ухода и поддержки, так и для профилактики, были разработаны стандартизированные пакеты, которые детально описывали объем тех услуг, которые должны быть предоставлены.
And what was also highly important here is that for both the preventive services, which was regulated by an order, and for the support services, this is also regulated by an order, there has been developed a specific package of services. So under the name of every single one of that, they actually standardized the specific package of services to be provided within each framework.
И после того, когда вся эта работа была сделана, мы перешли к пилотированию новой модели финансирования, и мы рассмотрели две основных таких больших модели: централизованная и децентрализованная модель.
So after all of that preparatory processes had passed, and after we finally understood that we were able to do something, we started to pilot, and we started to pilot it in 2 types of models. The first one was centralized, and the second one was decentralized.
В централизованной модели мы пропилотировали такую модель, когда Центр общественного здоровья, имея деньги гранта Глобального фонда, отобрал национального координатора, который уже в свою очередь отбирает региональных провайдеров.
So the centralized model, or model number 1, is when Global Fund's funding is going to the public health center, which picks the national coordinator the national coordinator itself picks the regional providers.
И это было обусловлено тем, что мы действительно боялись, что довольно сложные государственные бюджетные механизмы могут не сработать. И когда мы выбираем одного или двух национальных координаторов этих сервисов, мы минимизируем риски подобного провала.
And this model actually came from our deepest fears that the state bureaucratic procedures regarding the funding would actually fail along the way. And this is why by like selecting one or two national coordinators, they would contract providers directly. We would think that this is how we would be able to solve this issue.
И при финансировании глобального фонда мы пропилотировали централизованную модель номер 1, которую вы видите на левой стороне слайда. И также попробовали внедрить централизованную модель номер 2, когда мы выбираем напрямую точечные организации с хорошей репутацией, с большим опытом и закупаем услуги у них напрямую.
And so this is why we piloted the model number 1, but we also tried model number 2 when that you can see on the right on your screen, when the public health center actually picks the number of selected trusted providers to be able for them to provide the secure services on the regional level.
Также мы думали о децентрализованной модели, поскольку общая государственная стратегия, которая сейчас, и та реформа, которая в стране идет, она в целом является децентрализационной.
And so that was the two centralized models. Right now you can see on the screen the decentralized models. And this was created just because the general idea of reforms in our country goes to the support of decentralization process.
И мы планировали, что государственный бюджет будет направляться в Центр общественного здоровья и потом переходить в координаторов регионального уровня. Это может быть региональные public health центры или областные администрации.
So we planned it that way. So for the state budget to go into the public health, from the public health center as the coordinator, national coordinator, it would go later on to the regional focal points. For them to then, it can be either the regional public health center or regional or oblast state administration or laboratory or something else. So, and then from them on, they could be able to select the providers and to contract them as well.
И, к сожалению, эта модель оказалась крайне сложной с точки зрения организации, имплементации, контроля, и в юридическом поле ее оказалось практически невозможно реализовать.
And unfortunately, this model has shown up to be really, really complex, almost impossible to implement. It's hard to control and track and monitor. And it's in reality, legally, it was almost near to impossible to implement it that way.
И текущая модель, которая сейчас используется, это когда деньги государственного бюджета переходят в Центр общественного здоровья, и мы закупаем эти услуги у региональных провайдеров.
So in the model that we have right now is when the state budget gives the fund to the public health center, and we ourselves, as the national coordinator, we procure services from the regional service providers.
Мы закупаем только базовый пакет, который является минимальным, через специальную систему электронных закупок, которая называется Прозора. Это национальная информационная система, которая в автоматическом режиме рейтингует участников и позволяет избегать коррупционных рисков.
We are only procuring the basic packages. We are doing so through the electronic procurement system named Prozoro, which was the leading innovation of Ukraine as one of the most transparent state procurement systems that allows us to indicate the trustworthy services providers from less trustworthy by the number of indicators that the system uses itself and has itself and pre-installed.
В то же самое время региональные провайдеры услуг могут использовать деньги местных бюджетов или областных бюджетов или проектов, которые реализуются в стране, для того, чтобы обеспечивать расширенный пакет услуг. Таким образом, это является дополнительным финансированием, которое позволяет усилить интервенции.
And so the regional services providers and the regional authority, they can, because since we are providing for the basic package, and basic package only is procured by us from the national level, the regional or local levels, they are able to use the funds from local authorities, regional funds, or from the donors from the project to actually provide for an advanced package or a broader package of services to just provide a bigger variety or scope of services.
И за Центром общественного здоровья, как за государственным учреждением, остается функционал по координации и сопровождению всех этих сервисов, начиная от момента планирования, закупки, так и контроля качества предоставления.
And under the Public Health Center Ministry of Health as the state institution, we still have a coordination function starting from the process of planning, procurement, implementation, monitoring and control.
Если посмотреть на общие суммы денег, которые выделялись государством в 2019-2020 годах, то действительно мы видим еще и рост этой суммы, то есть увеличение ее.
If you would take a look at the overall amount of funds dedicated by the government for all of those programs from the year 2019 to 2020, we can see that here we have a significant growth.
На левой части вы видите суммы, которые выделялись в 2019 и в 2020 году на профилактические сервисы.
So on the top you have a level for 2019 and on the bottom 2020, and on the left of the slide you have the funds provided for HIV prevention services for key populations.
На правой части это сервисы, которые относятся к уходу и поддержке.
On the right of the slide you have HIV prevention services for HIV actually care and support services for key populations.
И, безусловно, вот такое увеличение финансирования – это тоже заслуга адвокационного компонента, который реализовывался основными реципиентами гранта Глобального фонда.
And this increase in numbers has only been possible because of all of the hard advocacy activities that has been implemented by every single grant receiver of this grant.
На этом слайде указаны основные этапы реализации плана перехода в Украине.
On this slide, you can see the main stages of implementation of transition process and plan in Ukraine.
Фактически в 2020 году мы полноценно перешли на закупку услуг и полноценно покрываем уже все национальные цели.
So in 2020, we successfully moved to the state procurement of all of the HIV-related services and cover all of the needs based on national targets and indicators ourselves.
И все бы это не было возможным, если бы действительно все партнеры внутри страны не консолидировались вокруг единой цели и не помогали бы государству принимать правильные решения на разных этапах.
And none of that would be possible if there would not be a consolidation of all of the partners from the national level and international level to support the government and directing them into the right direction for decision-making process.
Какие же мы видим достижения и вызовы в реализации плана перехода?
So what kind of challenges and achievements we see as possible outcomes of the transition plans?
Безусловно, среди основных достижений мы видим то, что сейчас сервисы по профилактике ВИЧ-инфекции и сопровождению пациентов с ВИЧ-инфекцией, они являются частью национальной системы ответа на эпидемию ВИЧ-инфекции.
The first achievement that we would like to have is the integration of prevention programs and non-medical support for people living in HIV into the national HIV and AIDS epidemic response programs.
Второе достижение – это то, что нам удалось за все это время поместить программы по ВИЧ-инфекции и по туберкулезу в единую рамку public health.
And the second achievement that we have is that we were able to put all of the HIV and tuberculosis-related programs into the framework of public health programs.
Также большим достижением является принятие общенациональной стратегии до 2030 года с трехлетним циклом планирования.
The big achievement for us itself is development and adoption of a national strategy in the field of counteraction of HIV, AIDS, TB, and viral hepatitis until the 2030 with the project or strategy year plan for every strategy for 3 years.
И последнее достижение, которое мы видим, это то, что механизм закупки услуг по механизму открытых торгов все-таки запустился, и на сегодняшний день государственным финансированием покрыт 100% от тех потребностей, от тех цифр, которые мы планировали.
And the last but not least, among the achievements that we have was the establishment of an effective mechanism for the services procurement under an open bidding process and procedure that has been introduced before, and so we were able to provide a complete 100% of state funding covering all of the need.
Какие же основные вызовы у нас есть, остаются за исключением ковида? Потому что ковид, наверное, сейчас для каждой страны является глобальным вызовом.
So what kind of challenges do we have in terms of transition plan apart from COVID? Because as far as we understand that every country right now struggles with COVID as much as we do or even more.
Прежде всего, это обеспечить устойчивость этого финансирования в соответствии с национальными целями.
The first and foremost would probably be this provision of sustainable funding in accordance with the national targets and indicators that are set out in the strategy.
И действительно, для того, чтобы такое финансирование было обеспечено, должен быть определенный баланс между определенным политическим диалогом и адвокационными действиями неправительственного сектора.
And for that portion to be actually supported and continued, there is supposed to be a specific balance between the advocacy activities and decision-making processes in the MPs and the parliament, for example.
Следующим вызовом для нас является создание единой системы учета и анализа данных, поскольку неправительственные организации, которые реализовывали раньше такие программы профилактики, ухода и поддержки, они использовали разные информационные системы.
The next challenge would be upon us is the establishment or creation of the unified single system for accounting and data analysis in both direction of the prevention services and support services, because so far all the NGOs that were providing services of that kind of in the field, they were using different and dispersed information system for data collection and monitoring.
Третьим вызовом для нас является все-таки возможность расширения этого пакета, поскольку мы хотим предоставлять дополнительные услуги, внедрить дополнительные сервисы и иметь возможность пересматривать эти тарифы.
So the third challenge in front of us would be the possibility for the future expansion of basic package, because basic package is good, but we would really like to include their additional services or additional things, and also include an ability to, in a timely manner, revise the tariffs and the fees for the future.
И последний вызов, который у нас есть, это интеграция закупок расходных материалов, шприцы, тесты в национальную систему закупок, чтобы мы могли их закупать за деньги государственного бюджета.
And so the last challenge that we have would probably be the integration of consumables to be able to procure, so like syringes, tests, and everything, into the national procurement system for them to be legally procured for the state budget.
Это мой последний слайд, и я хотел в этой презентации представить поэтапно и покалендарно, каким образом происходил план перехода.
Thank you so much. This was my last slide, and in this presentation, I really wanted to present to you stage and step-by-step approach for the transition plan that we had in Ukraine.
И я бы хотел еще раз поблагодарить всех партнеров в нашей стране, как национальных, так и международных, за слаженные действия и за поддержку.
And also, I would like to express my deepest gratitude for all the partners within the country and outside of our country, so national and international partners, for all the help and support that we were having.
И, безусловно, большое количество работы уже было сделано, но еще большее количество работы предстоит делать.
So, and we understand that we have done so much work, but there's so much work still lays in front of us.
Спасибо за внимание.
Thank you all so much for your attention.
And we thank you very much, Dr. Kuzin, for this really impressive presentation and insights. A digital applause for you from our viewers altogether. I think that's fair to say. And I think it's also, I can speak for all of us digitally assembled here when I say that we wish you the very, very best for the continuation of your endeavors. And we will certainly follow Ukraine's path over the coming years to come. And I certainly, I'm specifically grateful because I think your examples really illustrated how complex transition processes are. It is about financing, but it's not just financing. It is there are issues of governance, there are issues of data systems, there are issues of integrating various programs. You illustrated the complexities of the national and the regional responses. I think that was a very, very eye-opening. And I would like to continue our discussion here with one of the most iconic rallying cries of the Sustainable Development Goals. Yes, Heidemann, of course.
No, I just wanted to ask perhaps to the two colleagues. One thing is, what difference is there between with the different regions in Ukraine? I mean, are there difficulties in adapting on one thing? And the question is, what's the future of, well, once the Global Fund is completely out, what's the future then?
Спасибо большое за вопрос. Действительно, ситуация в Украине отличается от региона к региону.
Thank you so much for the question. And yes, the Ukrainian situation is different from region to region, so that not all alike.
И у нас есть система приоритизации областей, и есть приоритетных 12 областей, которые мы относим к регионам высокого риска.
And so, because those regions are different, we have 12 priority regions that are considered to be high-risk regions.
И для каждой области, для каждого района формируются свои определенные целевые индикаторы по достижению как профилактическими программами, так и по уходу и поддержке.
And so by every region or districts, we have our own indicators for each and every one of them to set the expectation and the plausible area for them to be able to achieve it.
В рамках нового гранта Глобального фонда, который сейчас будет реализовываться с 1 января 2021 года, мы планируем продолжить процесс перехода и максимально обеспечить государственное финансирование того пакета, который сейчас реализуется.
In the framework of the next year, the Global Fund grant that we will have and that will start in January 2021, we are planning to broaden the scale and to ensure the sustainability of the state funding for all of the Ukraine, for all those services of prevention and non-medical support.
И последнее, мы сейчас как раз думаем о том, чтобы действительно применять таргетированные интервенции по отношению к регионам высокого риска, и в том числе, чтобы иметь определенную мобильность в том пакете, который предоставляется государством.
And so this is why it's really useful for us, because we'd like to have some level of flexibility between the regions and also to have a slight flexibility in the amount of services included into basic package.
Yeah.
So thanks again. And let's discuss now the specific needs of vulnerable populations and key populations, which you also mentioned in your presentation. So there's one sentence that was repeated over and over through the transition of the MDGs, the Millennium Development Goals, to the SDGs, the Sustainable Development Goals. And I'm talking about the sentence, leave no one behind. And I think it's an incredibly important and also very thoughtful sentence because it captures really so many things that health and the human rights are not achieved as long as they have not been achieved for all of us. And I now want to discuss these issues with two experts that I'm very fortunate to have here with us. First of all, she's a public health expert who works with very close ties to civil society organizations across Eastern Europe, Central Asia, trying to increase sustainability and reduce harms of donor transitions. Welcome, Raminta Stükte.
Hello.
And we are very grateful to have with us the General Secretary of the National Coalition of People Living with HIV in India. He is also a member of the community's delegation on the Global Fund board. Welcome, Manoj Pardesi. And we owe specific thanks to you because it is already quite late in the day for you. Thanks very much for joining us here. Manoj, let me start with you because I think it is important for our discussion because we're having covered many different issues, complex issues, abstract issues. I want to talk for a moment about people because healthcare is about people. If I was to ask you to describe a person that really depends on the policies that we discuss here, what kind of person would we have to imagine here in this group?
Can you repeat your question again, please?
Yes, maybe we could speak up a little bit.
Yeah. Can you repeat your question again?
Yes, of course. So if I would ask you to describe a person who really depends on the policies that we are discussing here, how should we imagine that kind of person from the background of your experience, having worked with marginalized people and key population?
based mainly on the transition part. Okay. Yeah. Am I audible? My voice is coming?
Yes.
Yes.
Okay. Okay. So let me put you in this way, like I have the notes with me. So like the word transition, I see a disconnect between the global fund and the country. Basically, the understanding of the word transition. Yeah, because for the global fund, the transition means like, and the global fund and all the development partners, along with the global fund, understand and supports the involvement of civil society, key affected populations, and different communities like PLHIV, IDU, MSM, and everybody. And they acknowledge the role of the community in the entire response of the disease response. But for the government, transition means only the covering the cost of treatment. They don't think like civil society engagement is also part of the disease response. Especially it affects on the community system strengthening part. It will affect on the advocacy part, because government will not fund advocacy. They don't want people to be engaged in the advocacy work. So that's the difference. That's the disconnect between the fundamental thinking process of the word transition. If you ask me as a community member.
Oh, thank you. And Raminta, so that's only one very, very valid concern. Raminta, if I would ask you to name us your foremost and largest concern about transition processes, what would it be, and then how far would it relate to what Dr. Kuzin just presented?
I work in Eastern Europe and Central Asia, and there have been multiple countries that fell off the wagon of donors. And what we saw, what happened on the ground, we saw people who are affected the most by the disease, who are poor, some of whom live on streets, people who use drugs, people who are sex workers, but also gay and other men who have sex with men, who are politically unpopular groups. We saw them being left behind. And those who were serving them, not having any more funds to actually provide services and work with the communities. So that is probably the largest concern, that there won't be funds and there won't be mechanisms how government will want to support those services, or governments will not be willing, ready, and able to do that. And we have seen that across the Balkans. We have seen actually in some European Union member states where the Global Fund has been funding services, including Romania, including Bulgaria. So Bulgaria has been praised as one of the successful cases for transition, with some steps towards government starting to fund services for key populations. But this year, we saw the oldest harm reduction service group closing because there were no services. Mm-hmm. And all people who use drugs left behind because there was nothing. The service that used to serve them for more than 20 years were not able to sustain, even while they were managing to sustain somehow for a year without funding. But it's so much that people can work without salaries.
And anybody who is doing a little bit of research about this will always stumble about a number of surveys and studies that are being brought about this. So one was brought forward by the Open Society Foundations covering Macedonia, Montenegro, and Serbia already a few years back, where you pointed out, where this study pointed out a few of these points of criticism that you just raised. Do you see any kind of development? Is the donor community, is the international community listening to these concerns? Do you see development since those studies have been brought forward?
I see that the transition in particular has become much more sort of the term that has been used much more. There is much more attention to the issue, including from the Global Fund, which has framed its policy and guidance how to do that. And that there is more discussions, what about sustainability, even in the countries that are far away from the transition. So I see that. But there are some elements that I don't see. So one element about eligibility being very linear, not nuanced, even within the Global Fund, I don't see that changing, unfortunately. So some countries can fall off the eligibility list, and then they have to wait for 2 years. Even if they have, epidemic increasing, they have to wait for 2 years in order to get back to the Global Fund. And actually, those 2 years means that in practice, it's probably 3 years. So you have to wait for epidemic to grow in order to act. There is nearly no kind of like safety net. Like if Global Fund leaves, basically nobody's there anymore. So normally the Global Fund is the last one who leaves. So neither UNAIDS is there, WHO has very small staff. Civil society support mechanisms are also often not there because there is parallel transition also for civil society support, the donors that are exiting not only for HIV, but also other areas. And then the third area where I see, some examples, but probably not sufficient from donors, that it's not always about money. It's actually also political dialogue. At the country level, but also with local authorities, because local authorities are quicker to change. And, I think that when somebody like the wonderful chair of this meeting, the minister Heide Marie, would go to a country, and if she could manage to get some politician to see a service for sex workers, and, to talk to for law enforcement official or for the Minister of Health, to speak to somebody who is sex worker, who, to put the face on the issues that we call human rights and who is left behind, to hear the story of the person, who is struggling every day. I think that might change the hearts because it seems that the minds, it's much harder to change these days, with the evidence, even about money, etc. Last but not least, if I may put, is one thing that we haven't moved enough, so there are good steps, is about community-based, community-driven services. Yeah. I was asking one day Estonians who are presented as good practice example for the Global Fund transit policies, like who managed to sustain services. I asked them, so sort of what are the ingredients? And one of the elements that they mentioned is about the quality of services. If services have good reputation in the government, in the community, among the police, and among those who they are serving, it's much more likely to be sustained. And they would be much more resilient, as we have seen during COVID. Like community-based services were particularly resilient and finding very creative solutions to serve their communities. Sorry for speaking so much.
Thanks, Raminta. No, you raised very important points. And I want to maybe put them in 2 buckets, one being a political dialogue, which you just dwelled on the second part of your intervention. But I want to stay a little bit with the issue of finance, because also Andres in the first half of our online conference here raised the indicator of GNI as being a tricky one. And this is why I'm specifically grateful that we have Manoj here with us. Manoj, India is a very large country and is technically speaking, a middle-income country. And I want to ask you, are we focusing on the right issue here? Are we asking maybe too much from countries that have nomenclature of being middle-income country, but have a tremendous amount of challenges? I had a conversation with a German MP, a German member of parliament, a couple of months ago, and he said, well, it is difficult for him to convince German taxpayers to finance the health responses in a country that has a space program. However, a country like India has millions of people affected by tuberculosis. I think almost 25% of all people affected by tuberculosis live in India. Millions of people affected here. So the sheer size of the problem might be relatively small to the whole population of India, but it is an immense issue.
Right.
So what is your reaction to that, and how would your description be of what middle income countries are capable of doing?
Okay, so even like we consider India as a middle income country, I agree. Like every month we are sending one space rocket in the space, but we don't have money for the purchasing PPE kit or simple mask for the people to save their lives. So that's the reality and political commitment. And that's exactly what we also want to highlight, that the word, that is why I started with the saying that there is a disconnect between understanding of transitioning plus the punitive laws. Even like what Reminta is saying is that political will, but there are some certain punitive laws where political people also not want to engage with that. So basically sex work is illegal in India. Injecting drug use is illegal in India. So even political leader will not get engaged into it because it's a very what I say, like controversy for them. And those are the things also are the barriers when we say the word transitioning, because government will not work with the specific key population if the global fund moves out, or if the donors moved out from the country. And that's the again the biggest challenge for the entire financing. Second biggest challenge in India is basically health is a state subject, and whether it is HIV or whether it is TB, it, like in some states the numbers are very small, and for those states it's not the priority. And certain states the numbers are very high, but they have a different challenges. Like my states now, it's the COVID is a very high topic right now. So entire other health is now gone to the back stage, and COVID has taken the center stage, because all the hospitals are converted into COVID hospitals, and no people don't get services for other health needs. So
Right.
coming back to the point that it will the political will is the purchasing Rafale is our agenda, not the medicine and care and support is our agenda.
Okay, so but then discussing that political will, Raminta said it is also about political dialogue. I mean, your organization obviously is helping and giving people living with HIV a voice. Now we are here in the context of an international online discussion, and if we would really try to think hard about what other actors can do, what could the World Health Organization do, what could donors such as the German government do, what could the Global Fund do to support that political dialogue and strengthen the voices of those who are in danger? What would be your number one suggestion? What other actors could do?
Aminta?
Is it for Reminta or is it for me?
It's for you, Manoj, please.
Okay.
Yes.
So no, I think simultaneously, like one thing I must, this is the first part, but second part where we, Global Fund came to India in 2004, 2000 initially, but with the community, they started working with 2004. And since then, we used to advocate for the HIV/AIDS bill. And so many governments came and gone, but bill advocacy was continuously going on. So ultimately, the bill got passed in 2017. So that's the success of the community engagement. So I will again suggest, like, because community engagement with community requires small investment and big result. So the donors like the Global Fund and the German government, if you invest in the community, if you support the advocacy part, not against the government, for the policy change or removing the punitive laws and those kind of stuff, will help to increase that political dialogue.
I see. Raminta, you were also with our conference 2 years ago when we studied this issue the first time. And I remember one sentence that you said very well. You said, I don't want to have two Europes. I don't want to have one Europe that is dealing successfully with these challenges and one Europe that is not. Can you look like you remember the sentence, or at least the thought. So maybe can you illustrate that a bit more?
Probably we live in 3 Europes right now. Yeah. That's the reality, and even more fragmentation that we are moving towards. But in very broad strokes, I think that if you live in Germany, and if you are a person who uses drugs, you can access different services from, clean needles to probably shelter to special services for women, and to also hepatitis C treatment. And with dignity and without discrimination. If you live in my country that I'm based in, or in Bulgaria or Romania, which is new EU kind of member states, some of us have very different realities. And if you live here as the person who uses drugs, you have very different possibilities of how you can live, or what you can access, including in these times, but also before COVID. And therefore, some would migrate to Spain or etc. within the Europe. And then you have Eastern Europe, where for the moment we have, I would say, relatively good access to services. But I'm speaking about Eastern Europe, largely outside Russia. Which continues to have increase in HIV epidemic and quite low access for vulnerable groups, and for HIV, like prevention is really minimal in Russia still. But in Ukraine, in Georgia, in Moldova, you have really wonderful examples. What's happening there? How much they are successful. Managed to change the dialogue, and as we heard from Dr. Igor Kuzin, the really getting even government money to fund groups that are criminalized, which is amazing, in Ukraine. So we have those multiple Europes, and unfortunately, we will come back probably in 5 years, and we will have even more of those different stories. And I hope that because of the Global Fund change their policy, and if we manage to do more of the steps that I spoke about, political dialogue, about funding civil society, about investing in community-based services, maybe in 5 years we will have more single Europe.
That is a lovely perspective. Thanks to both of you. Tremendous thanks for sharing your perspective. Unfortunately, we ran out of time. But I hope you'll follow our final panel for tonight, or for today, which will bring in another 4 speakers. One you have already met, Heidemarie Witsch-Rögzoy. Welcome back. We will reflect together about what all of this means, what we learned and saw today. I also welcome the Deputy Director General for Global Health, Pandemic Prevention and One Health at the German Ministry for Economic Cooperation and Development, Mrs. Birgit Pickel. Welcome. Also with us is Dr. Agnes Souka. She's the Director for Health Systems Governance and Financing at the WHO. And last but certainly not least, we have on our panel Matt McGregor. He is the Senior Manager for Sustainability, Transition and Co-Financing at the Global Fund. Thanks very much for all of you for being here. And I just want to make sure that everyone has arrived and connected to our little digital platform, because I don't always see on my screen all of you. Can I just, sorry, for our viewers, because I don't see this, can I just make sure that Agnes and Ms. Pickel they're all there? Okay, wonderful. So Heidemarie, let me start with you. In your opening speech, you highlighted health as a human right for very obvious reasons. And this has just been underscored, I believe, by Raminta and Manoj in its incredible relevance. So is this our main area of concern?
Well, I think it is always important to remember and to remind ourselves that, for instance, well, the sentence, leave no one behind, exactly asks us to concentrate also on those groups that both of you before me have mentioned so much. And also, and we see it in the COVID situation, if you leave out these groups, there will always be a situation where you leave space for the virus. So it's important that we take indeed the sentence, leave no one behind, literally. And if I may say what we discussed and heard so far, coming back to the question of chances, yes, if you take the situation, there might be more competences, perhaps in the European Union. There might be more solidarity, but it might also be, and this has been mentioned by Kara at the beginning, that there is less funds, that development cooperation is receding financially, and also, and that's perhaps a point to discuss, of course, with the Global Fund and the board members, well, domestic resources. What do we ask people to use domestic resources in situations that you have described so far? And perhaps two last things. I'm afraid it's only 10 years from 2030. And I sense that at a certain time in this difficult situation, there might be people who say, well, if it's not 2030, it's perhaps another date. And we must not accept such a process and such an argumentation, and also take on board, I know it's not popular, but the question is, I've always been taking India, for instance, there is a responsibility for human rights wherever you live. It's not only that the government is responsible, but we also have a responsibility for human rights. That means the question of G&I is not the specific topic to take as the most important element for transition.
Thank you. So, Ms. Pickel, I would like to bring you in here, because since we're discussing human rights, and the German government just adopted its global health strategy, a brand new one, and human rights are explicitly mentioned as a basis for the work going forward. But I think what became quite clear already for this conference so far, Germany obviously can't do this alone. So who are the partners that you're hoping for in bringing together an alliance to safeguard human health and to make sure that nobody's left behind?
Thank you very much. And first of all, let me thank for the invitation. I'm very pleased to be here and to discuss this important issue, because it's very important to keep particularly these countries and the transition issue on the agenda in this time of a pandemic, where, as my former minister Heidemarie Wittschek-Zoll already mentioned, we will see fiscal constraints, and it will be more difficult to make this case for international finance. So it's good to discuss how we can jointly work towards keeping this important issue on the agenda. Now, in the we are at the Global Fund and in the board. We are now really deeply involved in the discussions on the future strategy of the Global Fund, which is in these times actually not so easy because of this context with the corona pandemic, etc. And we have changing goalposts and a framework which is uncertain. But still, I think the basic principles of what the Global Fund is good at: partnership, inclusiveness, bringing different stakeholders like government, civil society, private sector, communities together and work on solutions at the country level will remain key for the new strategy and also to keep the Global Fund attractive. I think the Global Fund has also been good at addressing human rights issues as part of the strategy, and it needs to continue to do so. And we, together with, of course, the civil society and community representatives, constituencies, but also other partners like France. I think as Europeans, we really strongly push the issue of addressing key and vulnerable populations and human rights. I think in the previous contributions, the issue of political dialogue beyond finance was really a good perspective, and maybe this is an issue where also in the future strategy more could be done. I think the Global Fund, on the one hand, is by funding and by including in the partnerships well positioned to address the issue. At the same time, I think on political dialogue, the Global Fund might be a bit stronger here and there, partnering up with, for example, bilaterals like Germany in country. And also other global health financing institutions like WHO, like Gavi, and so on, that need to work together to create that perspective and impact in the framework of the Global Action Plan for healthy lives and well-being. So maybe this is, as an introductory statement, my first input. Thank you very much.
Absolutely, thank you very much. And I want to bring in Dr. Sukkar here. Thanks for being here. We heard from Raminta and Manoj how essential civil society organizations are really to serve affected populations at the community level, home-based care workers for HIV, community-based DOT workers for TB, malaria extension workers, just to mention just a few. And now, Raminta says some of these activities can be endangered through transition processes. And Ms. Pickle just reminded us that COVID-19 doesn't make things easier. Sometimes the pressure in budget or capacity might hit just there. So how can we get better here and solve this puzzle? What are your thoughts?
Thank you very much, and thanks for this to the point question. So there is no doubt that the COVID-19 crisis has a major economic and fiscal impact, and that even if at this point it's unclear whether and how it would affect the transition, but certainly there is no doubt that the fiscal space will shrink overall. And that beyond an economic crisis, there will be a fiscal crisis. There is already a fiscal crisis in many countries, but it's probably a very strong one is looming. So that leaves us really with the question on how to learn from past transitions together. And bringing that together with the lessons learned from the crisis itself on what we have not really seen coming, and the collective failure of investing in the kind of health systems that would have prevented the crisis, or mitigated the crisis better. Either we would have prevented it, or actually we would have had an earlier and more effective response. And building on that, I would say that one of the key areas is to think about having solid social contracts and investing in the social contracts, investing in institutionalized grassroots processes that build the trust of population in their leadership, in their government, and that is one. And moving beyond the sort of donor-driven, external partner-driven investments in communities to actually develop institutional systems that create societal dialogue platforms that are sustainable. So basically engaging governments in consulting, dialoguing, listening to their population, and identifying the issues of collective action. And that really will require a shift. There is much that has been said today, but it's certainly what came out of the work of WHO together with the UHE 2030 partnership on universal health coverage, is that the transition is mostly about institutions. Because transition by essence is not about money. Okay. Because there is a transition because because the country gets richer. So okay. Transition is about building the kind of institutions in which there will be collective action that will both create a collective purse and have a consensus on how to use this purse. So I think it's really about moving away from small-scale community engagements to actually bringing together this institutional development. And the second point there is that I hear a lot the equity argument, and I'm totally wedded to it. I mean, those who know me know that I've been working on health and poverty for decades. But what the COVID-19 crisis has taught us is that there are two arguments for public investments in health services. Equity argument is a good argument, and it was made. But the other argument is the public good and the market failures. So what we call common goods for health. And that has been really a blind spot. It's been a collective failure in which we've seen, and we have the evidence in the data, we have the COVID-19 crisis is showing that to us every day, that we failed collectively in building the kind of consensus and partnership for advocacy and for collective action for those common goods to be funded. Okay, for the information, the coordination, the surveillance.
You raised great points, and I want to make sure that the other panelists have a chance to maybe take one at a time. So it's also will be easier for our audience to follow. Thanks very much. There's a number of really excellent points, and I want to start with the one you raised about institutions. Because since you said transition is not simply a financing issue, it is basically an issue of how to organize things. We saw very impressive presentations today by Dr. Kuzin about how they're preparing institutions and processes in Ukraine. And I want to give Matt a chance to chime in here. Your organization, the Global Fund, has already been mentioned here by Ms. Pickel, pointing out the contributions that the Global Fund can do. But maybe just to get us all on one page here, can you maybe briefly highlight some of the key pieces of the Global Fund's transition approach and how partnerships can help strengthen efforts to support successful transitions?
Well, yeah, thank you, Sturgis. And thank you for the opportunity to join the panel today. This is a really critical time to discuss this work on sustainability and transition. So I think it's always important when you talk about the Global Fund's transition approach to step back and talk about it the way I think you articulately summarized at the beginning, where we've had significant impact. You talked about the 38 million lives saved. We've also seen that impact in middle-income countries where we're dealing with transition challenges, where the transformation in who is providing services, paying for the interventions that are essential to HIV, malaria, and TB have improved over time. And so while there are still gaps, we've seen significant impact, even in middle-income countries. But we also know the landscape for global health financing is changing. And as I think Kara mentioned at the beginning, it's likely to change further. And so when we think about our transition approach, it's really a reflection of a few things. It's a reflection of the proactive need to work to sustain the gains. It's a reflection of the very tough decisions we need to make as an organization of how we allocate our funds and have the most impact while also continuing to address challenges in middle-income contexts. It's a recognition of the fact that domestic financing now plays a principal role in the financing of the disease responses, and we need to respond to that and be as catalytic as we possibly can be. And quite honestly, it's a reflection of some of the really tough lessons learned of previous transitions where we have either reduced funding or transitioned out, and we haven't always seen the sustaining of the gains that we would like to see. And so the overall objective here is really, how do we continue to strengthen impact in the short term with the funds we have while we address those tricky transition challenges so we can set up countries to continue to scale service coverage, which is the key objective in the long term. There's a lot that we focus on, and I won't go through all of it in detail, but to highlight a few things, many of which have been touched upon by panelists. I think the first is remembering impact first. We still have a relatively large footprint and still fund a significant amount of countries, and we can leverage those grants to address the coverage gaps that still exists, even in places where we're focusing on transition. The second, I think, is a heavy focus on supporting countries to increase domestic financing, both for health overall, as well as for specific interventions, because we know that there are specific interventions that are underfunded that are key to advancing against the three diseases. I think another thing is really putting a strong focus on sustainability of services for key and vulnerable populations, including sustaining the community systems that are often essential to providing these services in the first place. And then the last two I would mention is, really making sure we support countries to strategically address the health systems related transition challenges, whether it's procurement, integration, effectively including HIV, TB, and malaria into the ongoing push for UHC that are so critical to long-term sustainability. And we can often do that by really supporting countries to do robust, inclusive planning upfront. So we have a ton of levers on how we try to interact on these. We can use our grants. We can proactively offer tools like pooled procurement. We can leverage our co-financing policy to continue to push for financing at the national level. We can provide technical assistance. And of course, we can, and I think this is the focus of the panel, really leverage our partnerships. I mean, partnership is in the DNA of the Global Fund. And because of the complexities of this issue that I think the Ukraine case study really highlighted, we're going to have to partner with governments, civil society, communities, implementers, technical partners, other bilaterals, so that we can address these transition challenges in a comprehensive manner. Let me stop there. I know you're pressed for time.
Thanks so much, Matt. And I just want to pick up right on one point that you pick out one of the transition challenges that you just mentioned, and give it back to Dr. Sukkar, because I didn't mean to interrupt you earlier. We probably meant to come to that point again. I want to talk just very briefly about procurement, because it's such a critical issue, and we have only covered it very briefly just a moment ago. Many countries are well equipped to take over current donor-supported programs, but certain elements like replacing procurement mechanisms can be problematic, particularly for small countries with small commodity orders. What are your thoughts about potential support for these kind of countries, or for this particular transition challenge?
Thank you. On the procurement issue, again, it's an institution question. Procurement boards, procurement capacity, legal frameworks, all of this requires investments in institutions. And one of the reasons procurement is an issue in transition is that generally global health initiatives and donors did not invest in institutions, but developed parallel systems. So one of the key action point there is really to learn from from the old mistakes, so we can do new and interesting mistakes, and actually really from the beginning, even before transition, really invest in partnering with the institutions like the World Bank, like WHO, who work in the institution building space, to develop the legal frameworks, to develop, to invest in the capacity, to invest in the establishment of institutions, and not find ourselves in the typical situation when the transition the transition comes and suddenly we have to think about how to transform something that was a specific donor-funded system into a national institutional setup. And you know that this has created issues in many places. So first is we really need to invest upstream in developing these institutions and capacity, and that requires, again, much more partnering of organizations like the Global Fund with other organizations who work in that space.
I see. So that is not, again, not only the finance issue, but again, the partnering or the dialogue issue. I think political dialogue is something that already came up. There's one mechanism in many countries that have been supported by the global funds, and that's the country coordinating mechanisms, the CCMs. Matt, they play a key role in global fund processes. Do you think there's a way how we can leverage CCMs to strengthen our work in sustainability and on transition, and ensure this dialogue and sustain this dialogue that we've been hoping for already in this conversation?
It's a great question.
I think it's oh, sorry, it was not for me. Okay.
Yes, Matt, please.
Sorry, I didn't know if it's for me or for someone else. It's a great question, Sergius. In many ways, CCMs are a real reflection of the Global Fund's push for partnership, since they're an attempt to make sure all stakeholders are at the table. I think when you think about CCMs in transition, there's a few things to think about. I mean, one of the incredible impacts of the Global Fund's model has been the ability to push and incentivize countries to ensure really strong multi-stakeholder dialogue on the best ways to fight HIV, TB, and malaria, including the voices of affected populations, civil society, communities, and ensuring that those voices are at the same table as ministries of health and ministries of finance and development partners. And this is one of the incredible legacies in many ways of some of the Global Fund's work. And so when you think about CCMs in transition, there's no one size fits all approach, of course, and it depends quite a bit on country context. But I think there's a few key points, and I think there's a key question. And the key question is, how do we strategically engage and leverage CCMs to support transition processes themselves, and to make sure that the principles of CCMs, this multi-stakeholder, robust, inclusive dialogue, are maintained even beyond global fund financing, because it's such an integral and important part of national governance. Right. And so on the first piece, on supporting transition processes, there's a number of things CCMs can do. They can monitor transition planning. They can make sure that KVPs and civil society contribute to transition dialogues. They can effectively advocate for countries to finance critical aspects of health systems that we know are essential to HIV, TB, and malaria. And then on the other question, we know that CCMs can think through in advance, how do we make sure that the principles are sustained? And there's a number of ways to do this, including aligning and merging with national governments mechanisms so that those principles are integrated. And we've seen that in a number of places. Or potentially thinking about other ways to make sure that this dialogue continues, since it's been so critical to making sure we have the most effective HIV, TB, and malaria responses.
Thanks. Ms. Pickle, what are your thoughts about this particular instrument? Is it promising?
Well, I think it's. I would really like to echo a lot of what the colleague from WHO said on institution building in the first place. That is key. And I made a small reference to the Global Action Plan and working together with other health initiatives. And I think that is key. And we do do think that this is the way to go for the Global Fund. It's not like it's not happening, but I think it needs to happen more. And that same principle applies to the CCMs. I think the CCMs are a great instrument because, as I said earlier, they bring partners to the table. I think we need to look very carefully at the moment how the pandemic situation impacts on the ability of the CCMs to be inclusive. I mean, working in this virtual world now, and it's not easy. And we have heard that there are some downsides, and we need to be careful that the inclusiveness really can be maintained. Overall, I think CCMs are then really helpful and good if they integrate to the extent possible international structures. They include other health actors as well beyond the Global Fund grant application system. That can be a starting point, but I think now almost 20 years down the line with the Global Fund, I mean, there is a birthday coming up in 2022. So that should be the way to go, to move, and if it is a gradual move into a more holistic CCM structure. We have been great supporters and strong supporters of the CCM Evolution Initiative, which is now being rolled out to more than 90 partner countries, I understand, and I think that is a promising way to go. So it is really about building systems, as the colleague said, and we know, and this is what we're discussing at the board, the trade-off question between speed and results and long-term funding and systems. It needs to be balanced. So while we all want to see impact, it's crucial, also with a view to the next replenishment and so on. I think we can do both. And sustainability we will achieve, and results we will achieve through the systematic approach.
So it's a very differentiated look at things, as also many countries face very different challenges. Matt already said it's not one size fits all. We learned from Dr. Kuzin that even within Ukraine, the various regions, not surprising for such a large country, have very, very different challenges. Heidemarie, is that one of the main conclusions for the day, these differentiated approaches?
Well, I mean, can I say in a very personal manner, you know, the question of CCMs is such an achievement which we reached when the Global Fund was created, that indeed we have to keep all the advantages that it creates, the dialogue, taking into, of course, also other partners, but the CCMs is for the dialogue between civil society, governments, and others is decisive. And it should be financed also beyond, even in countries which are in a transition process or even have reached the transition stage. And also what has been mentioned as very practical points, what has been mentioned, the question of pooled procurement. I mean, it's so important for those countries, well, not to fall back into situations where they have to pay high prices for drugs and everything like this. Perhaps one conclusion, well, which is also a rather personal conclusion of the debate. I think, well, we have the aspect of universal health coverage, and everything that we've discussed also from all the experiences that the colleagues that participated mentioned, we must prevent getting into a situation where there will be partial health coverage, which would be the exact opposite of what is needed. And there I see one problem. We have the Sustainable Development Goals. We have all these decisions on universal health coverage. But actually, I mean, they are software. But we also need is hardware, which is who is, in a way, trying to assess, to monitor the real results. And that's one of the problems where it's all perfect, but the high-level political forum, which meets in July, certainly cannot play this role. So software, yes, but also hardware, a real monitoring of the results. If not, well, we'll be in 2035 or 2040, and the things will not be reached. So from my side, can I say thank you all very much. Has been a very interesting and, well, with many facets, important points, and specifically those who are working in all these areas. Thank you very much, and all the success that you deserve so much.
We have a bit more time, even though this was almost like a final word.
Well,
but I interpret this like the call for hardware. This is another support for the strengthening institutions, which is certainly welcome. For a quick final round, Matt, if you had the chance to highlight really just 2 or 3 main things that you would like to underscore that would allow us to sustain the gains that we've achieved so far, which ones would those be?
So I think, Sergius, you're probably you're thinking about transition overall as well as transition in the context of COVID. And I know we're short for time, but I'll mention a few. Everyone has mentioned already that there's no doubt that this is going to be a challenging time for this dialogue. But I think in many ways, our ability to achieve our objectives is going to depend a lot on our ability to do the underlying things that make transitions successful as well as we possibly can. And so a few of those things that we're going to really need to pay attention to are things like efficiency. We know that it's going to be difficult to raise resources moving forward. And so we're going to have to think about how we can be as efficient, as effective as we possibly can and support countries to get there. At the same time, even though there are going to be vast economic challenges, we also know that there are still financing needs. And so as a community, we need to continue to advocate with countries to adequately finance health systems and the 3 diseases to the extent that we can fill those service coverage gaps. Because if not, we could actually take steps back during this pandemic. And that's something we certainly want to avoid. And then I think the last thing would be, it is not the same, and service coverage for HIV, TB, and malaria is not the same for everyone. And I think there are really serious issues of equity when it comes to trying to sustain the gains and make sure that we respond to this pandemic. And so as we think about how we navigate transition, we need to be thinking about how we put a very strong laser focus on maintaining the sustainability of services for key and vulnerable populations. These are often the populations most affected by the 3 diseases. Yeah. And if it was challenging to reach them in transition contexts before the pandemic, it's going to be much more challenging moving forward. And so really making sure as we think about how we address these challenges, both on transition and in the context of the pandemic, really doing that with an equity lens, I think is going to be very, very important, notwithstanding all of the other important things like institution building and public goods that are also going to be essential. But it will behoove us to really focus on that as we try to navigate this challenging time.
Ms. Pickett, you haven't really had a chance so far to consider the effect of COVID-19. I mean, transition is the outline that countries have lower disease burden and better options to mobilize their domestic resources. COVID-19 probably will mean that both those indicators will go into a negative direction. Countries will have less economic potential. Countries will have higher disease burden. What's your number one thought with this? Looking at transition processes?
Well, we have already heard constituencies at the board level asking for a sort of rethinking on those countries that are lined up for transition. So that is an issue to be discussed. But I think it's too early to go into details. I think it is important to have a close look at what is realistic with regard to specific countries. I mean, generally, I believe that it is very, very important to start thinking about transition early on, not, probably 2 grand cycles before, countries might move in this direction when you look at the normal economic indicators, socioeconomic indicators, because it does take time to really integrate into systems. When you look at procurement, for example, the Ukraine example was excellent. I mean, that has been a long way to get where they are now. So having said that, I think we need to really carefully consider the data that come out of this pandemic on the economic and the social indicators as well. But as it is also very much linked to political will. There's the economic side, but political will in countries that can allocate funding to the health sector. We should not let them, lose their responsibility to really mobilize that domestic funding. I don't want to name single countries here, but we do know that also on the African continent, for example, some countries could do a lot more on domestic financing for social sectors, particularly health and education. So for me, it's a mixed bag. To sum up, we need to take a realistic look at the data, but not lose sight of the long-term, medium to long-term transition perspective. And we do need to take a country-specific approach. That is quite clear.
Dr. Sukkar, we're almost over with our time. This is why I want to hand you the magic wand. And the magic wand has engraved in it perfect transition processes. So you can move it and it grants any wish. What is your first?
As I said, my first wish is really that we take on board this lesson from the crisis about establishing sustainable institutions. And I listen and I hear all the great work that the CCMs have done, but that's exactly an example where usually when the transition comes, CCMs are still in their own space and have not led to the establishment of a societal platform that, in the way that it happens in mature systems. National health assemblies like the one in Thailand, societal dialogue like in Tunisia, a state general of health like it happens in most European countries. So we're still very much in a donor space. When we talk of transition, we need to get out of our zone of comfort of an aid space and move towards a societal contract, a social contract space. And that's really very much the lesson of COVID, because if we want to build public trust, if we want to build the consensus to fund the common goods, then we need to bring all of society together. We need to not only address the equity argument, but we need to address the collective argument, the public good argument. And that one has been systematically forgotten. And if we want to address that, we need to move out of our box of disease or our box of aid and come out into the building of inclusive institutions that foster a sustainable dialogue between people and their elite, their government, their scientists, because this is where we found the core weakness of the COVID crisis.
Thank you. So this is almost close to the magic mixture that Kara Hansen suggested of solidarity and health security. Heidemarie, you're the host. You have the last word.
Yeah. Well, I don't know whether, I would draw conclusions that all of you would draw, but could I say on the very practical point, it is, to my opinion, important to encourage the board members of the Global Fund to revise, or let's say have a closer look on the consequences of the two indicators that Sergius has mentioned after COVID. And this is going to be also a financial question, not only an institutional question. I agree, of course, that the CCMs must become a much broader way of interconnecting groups, peoples, and initiatives. And perhaps you will think that I'm hopelessly non-governmental, although I've been in a government for 11 years. But of course, I'm all for efficiency. Yes, of course. But I mean, the way in which we judge these questions from other questions where you have rising military expenditure, which has got no control whatsoever, nothing whatsoever, no question of efficiency in this field. So I'm all in favor of monitoring also our jobs and our positions very, very much, but also look at the society as a whole and the tasks of the governments and see to it, perhaps the fight against viruses and pandemics need that we revise also our thinking about global public goods also in other spheres. So once more, thank you very much and all the best for all the tasks that you have taken on board. Thank you.
Thank you also from me. It was a privilege to discuss these issues with so many outstanding global health experts. Thank you very much for our viewers. If you stayed with us, this was 2.5 hours of discussing transition processes for Friends of the Global Fund Europe. Thanks very much and have a great evening.
And thank you, Sergius, for standing in, because you did it from one day to the other when your Jakob Simon came ill. Thank you.
Well,
It was
thank you.
Thank you very much.
Bye-bye.
Thank you, everyone.
Bye.
Bye.